It is June 1st, 2025, and it was 2 years ago on this date when the doctor said they also found a tumor. So, if you're new to my YouTube channel, perhaps you or someone you know went through or is going through cancer treatment. Um, what happened was, yeah, so June 1st, 2023, I went to the hospital to get checked out because I knew something wasn't right. And the doctor was suspicious of a blood clot in my right lung. So they did some tests, and eventually they did a CT scan. And I'm sitting there waiting for the results, and the doctor comes in and says, "Yep, we actually found two blood clots in your right lung." And I'm thinking, this sounds pretty serious. That's when the doctor said they also found a tumor. Okay, that was a hard pill to swallow. So then, yeah, he said, I'll be referring you to the cancer clinic, and you get a call in about 5 business days or something like that. But instead, I got a call from, what was it, a respirologist clinic, and I guess they figured, well, before we admit me into the cancer program, then they'll let the respirologist determine whether it's lung cancer or not, seeing that the tumor was found in my lung. And the tumor they found in my lung was about 35 millimeters. So, and the doctor said, it could be cancerous. Could be. So, anyways, I go to the respirologist clinic and have my first visit there. And the respirologist is looking at the CT scan that discovered the tumor in my right lung. And he's looking at it and he said, it looks like there's also a smaller spot in your left lung as well. Okay, so I'm thinking, can this get any better? Yeah. So, so he ordered. He said he's going to order a lung biopsy and a PET scan, and then he said on June 27th, between the hours of 3 and 4 p.m., you'll be getting a call for the results. So, yeah. So June 27th rolls along, and I get the call, and the doctor said that the tumor is malignant. So on June 27th, I found out I have lung cancer. I could have waited the 27th to make this video and say it's been 2 years, but um, either date had a significant impact. Okay, so I had my first visit with the oncologist at the hospital, and she said to me that one thing you have to remember is that this is something it's never going to go away, probably because of the stage I'm at. And so I said, so what stage am I? And she said, you are stage 4. Well, another somewhat of a tough pill to swallow. So, and we talked about this and that and other things. And okay, so she said she's also, then she says, she gave me the full report, the whole rundown, because the PET scan really finds everything. So, and she said, the primary tumor in your right lung is about 35 millimeters in size at the bottom, close to my spine. Okay. And then there's actually 2 in my left lung. Oh, and there's something, a mass up here in the top of my chest. Oh, okay. So I'm thinking, oh my God, this just feels like a death sentence. It's like my whole body's infested with cancer or what? So anyways, she said she's also going to send me over to a doctor that does radiation therapy. So I go there, and the doctor that does radiation therapy, I'm sitting there, and he's telling me that the mass up here in my chest is about like 25 to 30 millimeters in diameter and about, see, I think it's 7 centimeters long. It's like, Jesus Christ, man, I got a snake in my chest or what? Lymph nodes. Those are lymph nodes that, you see, when lymph nodes, enough of them enlarge, it just forms a big, long, elongated mass. So, and he was feeling around my neck and probing around, and he said, yeah, I can feel one right down here in behind my collarbone. So I'm like, I'm feeling it. I'm thinking, oh, geez, yeah. It feels like a grape stuck down inside there that's very firm. So I had 10 rounds of radiation therapy. And then as the days went on, I was feeling that lump and it was getting smaller and smaller and smaller and eventually gone. So, oh, and sore throat. Oh my God. Because the radiation beam was up here, like, yeah, it affects your throat. And yeah, I had a sore throat. And also, that's probably why, you know, at first, at first my voice was kind of hoarse because I think the one of the lymph nodes was pressing on the what is it, the what's it called, the recurring uh, laryngeal vagus nerve. Yeah. So I'm better now, and those lymph nodes are gone. So now back to the other oncologist and the nodules in my lungs. So we're talking about this and that, and the doctor said, "Do you want to be part of a clinical trial?" And I said, "Yeah, why not?" And it's something, some drug that has something to do with uh, not target specific for receptors, but boosting your immune system. So, but they did blood work, and my white blood cell count was too low. So there's strict criteria for the uh, clinical trial. You know, everyone's got to be on the same page. So they said, "Well, come back next week. We'll do more blood work," and did that, and still my white blood cell count was too low. So I guess I said to my doctor, "The clinical trial's a wash. Let's just get on with and do what we have to do." And she said, "Okay, well, seeing that you're not going to do that, and not because the clinical trial involves chemotherapy as well. So seeing that you're not doing that, there's another alternative." And she said, "Immunotherapy, which works by the receptors on your, it's a long story, receptors on your T cells and cancer cells, as it helps your immune system find the bad guys and kill them." So I said, "Well, let's do it." And she said, "There's only one catch. It goes on for 2 years." Oh, okay. And she said she's seen, can't make any guarantees, but we've seen good results. And the side effects aren't so bad. And she was right, the side effects are not so bad. So what happens is I get an IV infusion every 6 weeks, and it's just like a small IV bag, about 110 or 120 milliliters. And I'm in and out of there in about an hour and 20 minutes. So it's not all that bad. Okay, side effects. Let's see. Usually, if like the severity or how bad, it's on a scale of 1 to 10. Usually, it's about a 2. Lately, it's been a 1, and not all that bad. I feel a bit run down. I feel a bit yucky, headache for a couple of days, but I don't feel nausea or vomiting or anything like that, or really sick. So it's really not that bad. And so, um, oh, and along the way, I had a nasty bout with pneumonia, and and what happened was the doctor said if you get shortness of breath, it's kind of serious, then give us a call. So it was December of 2023. I'm sitting there on the couch thinking, okay, it's been about 3 days, and I have been noticing some shortness of breath. Maybe I should call. So I stood up, and I'm like, oh my God, chest pains, oh my God. And I'm getting some serious chest pains, accompanied by that, what do you put it, a feeling of kind of like cold sweat, sickening feeling. And I'm thinking, I think I'm going to be calling 911 instead. And then I was like, okay, is this going to get any worse? And then it went away. It left just as quick as it came. So I thought, okay, well, I'm going to make the call to my doctor's office and explain what happened. And the nurse said, okay, I'll talk to the doctor. I'll call you back. She called back and said, yeah, you want to get up here ASAP and head over to diagnostic imaging. They'll be waiting for you. They're going to do a CT scan, come back to the cancer clinic, and they'll do blood work. So I did all that, and then the doctor comes in and said, well, good news, your heart and your plumbing, everything's okay. It was just that you got a severe case of pneumonia. Well, it wasn't severe, but it was bad enough. I, mean, I think it's called walking pneumonia. So she showed me the CT scan. Looking at it, thinking, whoa, Jesus, the blinding white opacities. It should look like two empty caves, but halfway point in my lung, it was like, whoa. So, anyways, so anti-germy pills for a while. Okay, but so that was in December. But okay, a month before that was like the best news ever. It's like it kind of felt like the weight of the world was lifted off my shoulders. So if we backtrack a bit to November, about mid-November, I I'm at the oncologist. See, I have an appointment and blood work about a day before the treatment because they got to do blood work, make sure everything's okay and nothing's gone wonky in my immune system, and have to put the brakes on the treatment. So yeah, we backtracked in November of 2023. The doctor said, looked at the CT scan, and she was saying that, and this is just after two treatments. Okay, the tumor in my right lung went from 35 millimeters down to 6, and that's after two treatments. So, wow, it was like tears of joy. So anyways, yeah. Okay, so moving forward, after about 4 or 5 treatments, they couldn't find anything anymore. All the tumors are gone. So it's like, wow. It's, so it's been going quite well. Oh, and there's one spot in the bottom of my left lung that's been there all this time. It's been kind of in question for a while, and you might as well just stick a piece of eggshell inside me. Like it's about a little less than 1 centimeter in size, and I think it's a calcified granuloma, so it's nothing to worry about. But anyways, the months have gone by, and I get a CT scan every 3 months, and everything's been looking pretty darn good. The only thing is, one question I had to ask the doctor is, why is it that the COPD? I also have COPD. I quit smoking about 10 years ago, and it's as if the COPD waited to catch up to me. It waited all those years to catch up to me. Because I at first I asked, after I quit smoking, and after about 4 or 5 years of being smoke free, doing a speed walk up the hill, I could run about 2 blocks. I'd be normally winded. I guess I was doing so much better. But then, at the same time, the cancer hit me. The COPD hit me, and I said, well, "Why did it wait so long?" Well, that's just the way it goes because it doesn't have to be hit you right away. The COPD, after you quit smoking, it doesn't have to hit right away. No, it can wait and hit you like maybe 5 years later or 6 years later. And with me, it was like about 8 years later. So it's like, but she said, well, you are getting older. You know, I'll be 64 pretty soon, and so plus I guess the onset of other things probably exacerbated it, like cancer and other things. So but that's just the way it goes. But anyways, as for now, it's going to be, let's see. Uh, since then, everything's been going pretty good. I now yeah, I used to be. I used to have hind legs like a cat, and I used to run, jump, play, everything. But now it's like, well, a good example would be if I'm finishing the laundry, I carry the laundry basket up the stairs. Yeah, I feel that. Yeah. So, but other than that, I've been doing pretty good. Yeah, so far so good, and everything's been going pretty good. Uh, and looking at the calendar, it looks like I got 2 more treatments left, and then we're done. And I almost see it as we might as well say remission now. But I guess we gotta wait till the treatment's done, and then wait maybe well, I know that if I look at the calendar, okay, by mid-August I'll be done the treatment, and also I got another. By then I'll have another CT scan coming up, and then I guess maybe we'll wait 3 months for the next one, or maybe 6 months after that. I don't know yet, but after the treatment's done, they're going to wait a bit, run some tests, and if I'm cancer free, then they can say remission. However, when it comes to cured, they don't use that word for people that are stage 4. So that's the other thing. Um, if I was stage 3 and I went into remission, I stayed in remission for 5 years, then they can say cured. But when a patient is stage 4, and the doctors are always reluctant to use the word cured. If I go cancer free, okay, so me, I'm stage 4, like a stage 4 regional instead of distant. And if I go 5 years cancer free, they'll call it long term remission or remission long term or something like that. So that's the situation now. The treatment has been going quite successful. Um, I got this feeling, yeah, they're going to say remission, and hopefully I'll stay like that for as long as possible. And everything else is going pretty good. So, so far so good. So, anyhow, that's basically a kind of a 2 years update. Okay.